Hi, myself Dr. Vivek Sasindran and welcome to yet another episode of ENT Talks. Today we are going to talk about rhinoplasty. Well, what exactly is rhinoplasty? Rhinoplasty is a surgical procedure wherein you kind of reshape the nose. So basically if you have some kind of a deformity associated with your nose, predominantly cosmetic deformity, you can kind of correct it surgically, and this particular procedure is what we refer to as rhinoplasty. Now what are the common kind of deformities that you see? So generally, as the saying goes, beauty lies in the eyes of the beholder. Now what you need to understand is that an Indian nose is different from a Chinese nose. So what you need to understand is that nose is probably one of the most prominent structures of the face. So now this is something that gets noticed frequently. So what happens is that when you have some kind of a deformity pertaining to the nose, most of the times that becomes a cause of concern for the patient. So it could either be an over projected nose, it could be a big nose, it could be a broad nose, it could be a short nose, a long nose. So there are a lot of deformities, or from a lateral profile, if you see, there could be a hump over your nose. So all these are things that could be a cause of concern. So a solution to these kind of issues is what we refer to as rhinoplasty. So this is a surgical procedure where you can kind of reduce the hump. You can make the entire dorsum look straight. Now for some people the tip may be drooping. So if you want to kind of get the tip up, you could define the tip. If it is a bullous nose, a very broad nose, you can make the tip look sharp. Now if the entire nasal dorsum is broad, you can kind of make it more defined. You could increase the height of the nose. So there are a lot of things that can be done surgically to correct deformity. Similarly, if you have very wide nostrils, you can kind of bring it down. So there are a lot of things that can be done. But what you need to understand is, now for example, if you take the noses in India itself, now if you look at the South Indian population and if you look at the noses in northeastern part, the features are very different. You look at the Chinese noses, look at the Indian noses, the features are very different. So Chinese noses, you see that they are more flattened out. Now that is not the kind of noses that you see in India. So these features would vary from region to region, from race to race. So what you need to know is what exactly is the patient's requirement. So many a times the patients come saying that, I want my nose more pointed, I want my nose more defined. So they would actually tell you what exactly is the expectation or what exactly they expect from a surgical procedure. Now at times what happens is that these patients, apart from cosmetic deformity, they also have functional issues. Now they would say that they have associated nasal obstruction. Well, now most of the times there could be an associated septal deviation or deviation of the nasal septum with external deformity. So in those situations, a rhinoplasty alone would not be sufficient. You probably need to kind of club it with a septal correction or do what is called as a septorhinoplasty. I think I've already discussed septoplasty in one of my previous videos. So we combine what is called as a functional as well as a cosmetic surgery and do what is called as a septorhinoplasty. Now remember, when you have both these problems coexisting, it's always better to get it done in the same sitting rather than do one procedure, say I will get the nasal obstruction corrected right now and subsequently maybe I'll think of the cosmetic part later, because redoing a surgery is always technically more challenging and more demanding. So the best chance is probably the first chance. So if you have a combined issue, you should probably get it corrected in the same sitting. Now who would be doing a septorhinoplasty? Yes, so we have ENT surgeons who are trained in doing rhinoplasty surgeries. Also, you have plastic surgeons who can do the job. Thank you.